scanning. There's Colleen. There's Alicia. Christiana. Okay.
Hello, my name is Morgan. I'm going to be your student nurse today. How are you?
Good, how are you?
I'm good. Can you tell me your name and date of birth for me, please?
Alicia last name 12/11/90.
Good. And do you have any allergies?
No.
No allergies? Okay. Do you know why you're here today?
Physical assessment.
Good. And can you tell me the date?
February 12th.
Good. Okay. I'm going to check your name to make sure that you are who you say you are. Good. Okay, so patient is alert and oriented to person, place, and time. She does not appear to be in any signs of distress or illness. She appears her stated age of 24. She's dressed appropriately for the weather and for her age. Her speech is appropriate. There's no facial drooping. Okay, so we're gonna, do you have any pain right now?
No.
No pain? Okay, if she did have pain, I would PQRST it and you and ask if she needed anything for medication. So we're gonna move on to the physical assessment. Patient's head is normal cephalic, atraumatic. Her skin temperature is warm to the touch. There's no lesions noted. If she did have lesions, I would A, B, C, D, E it. Okay, moving to the eyes. Patient's conjunctiva is pink in color. There's no lesions noted. Just gaze off into the distance and I'm going to check your pupillary light reflex. Good. And follow the pen light. Good. So pupils are equally round and reactive to light and accommodation. So cranial nerve 3, 4, and 6 are intact. So I'm going to move down to the mouth. Go ahead and say ah for me. Stick your tongue out. Good. Okay, so patient's buccal mucosa is warm or is pink in color. There's adequate moisture. Upon phonation, cranial nerve 12 is intact. There's no deviation of the uvula from the midline. Her teeth are white in color. There's no chipping. There's no cracking. All 32 teeth appear to be visible. She does not have any dentures. Her tonsils are about a 2+ hypertrophied, but as stated in her chart, that's normal for her. There's no drainage or redness. Moving on to the neck. Patient's neck is non-tender. I'm going to check for carotid bruit with the bell of my stethoscope. Can you breathe in and out for me, please? And hold your breath. No bruits noted. Good. So now I'm going to check for the carotid pulse one at a time. Pulse is 2+ symmetrically. Okay, now I'm going to check for cranial nerve 5 and 7. So if you close your eyes for me and let me know when you feel me touching.
No. 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 No.
Good. And then open your eyes as wide as you can and shut them. Smile. Frown. Puff your cheeks out. Good. Okay, so there's no deficits in cranial nerve 5 or 7, sensory aspect of 5. Moving on to the motor, can you clench your jaw for me? So I'm palpating the masseter muscle and the temporal muscle, bilateral strength on each side. And can you resist my finger? Good. So there's no deficits in cranial nerve 5. So back to the neck. As I said, non-tender. There's no bruits noted. So I'm going to move to the heart. I'm going to be listening with the diaphragm of my stethoscope for the aortic pulse in the second intercostal space of the sternal border. Moving across to the left side, the pulmonic second intercostal space, sternal border. Moving down to the Erb's point, third intercostal space, sternal border. And I'm going to have the patient displace her breast tissue, listening at the pulmonic site, fifth intercostal space of the sternal border, and then the point of maximum impulse, fifth intercostal space, mid-clavicular line. I'm going to flip my stethoscope over, listening with the bell for 60 seconds. Here I should hear S1 louder than S2 at the apex of the heart, and then S2 should be louder at the base as I make my way up. So I'm going to go backwards, listening in all 5 spots again. noting any murmurs. So there's no abnormal heart sounds noted. So now I'm going to make my way to the lungs, listening at the apex of the lungs bilaterally in 10 different spots. Can you take a big deep breath in for me and blow it out? Same spot over here. Making my way down and across her chest, listening to the breath sounds bilaterally. I would do this in 10 spots, making sure not to go over the sternum or any ribs. Making my way down, listening to the lateral breath sounds as well on each side. And noting any adventitious sounds, and there are none noted. There's no wheezing, there's no rales, there's no rhonchi noted. So moving to the back, I'm going to be listening in the same spot, 10 different places. Again, when you feel me on your skin, just breathe in and out for me. And then you can just breathe normally, but for the video, 10 spots. Making sure not to auscultate over the scapula or the spine in 10 different spots. And then we already did the lateral. So while I'm in the back, I'm going to have the patient bend over and I'm going to check for her spine alignment, palpating the vertebrae. There's no curvature noted, so there's no signs of scoliosis or kyphosis. Okay, so I'm going to help the patient lay down and we're going to check for the abdomen. Her anterior posterior diameter was 1 to 2. So now inspecting the patient's abdomen, the contour appears flat and symmetrical. Upon breathing, there's no masses noted. Now I'm going to inspect the patient's skin color. It appears appropriate for her ethnicity. Now I'm going to move to, there's no lesions noted. Her umbilicus is midline. Now I'm going to move to the auscultation, starting in the right lower quadrant. I'm standing on the right side of her body, and I'm just going to auscultate for bowel sounds for 5 to 15 seconds. The right lower quadrant holds the appendix, the ascending colon, as well as the right ovary. Moving up to the right upper quadrant, bowel sounds are present. This is where the liver and the gallbladder are, as well as the ascending colon and the right kidney. Moving across, we have the left upper quadrant, which houses the spleen, the body of the pancreas, and the left kidney. Bowel sounds are present here. Moving to the left lower quadrant, we have the descending colon and the left ovary. Bowel sounds are present in all 4 quadrants. Now I'm going to percuss, noting any dullness over enlarged masses or organs, and tympany should be heard over free space. Any of that tender? Patient's abdomen is non-tender. So then I'm just going to lightly palpate with my finger, checking for any enlargement of the organs or tenderness. Let me know if you have any pain, okay?
Okay.
Okay, now I'm going to assist the patient to sit up, watching for jugular vein distension to disappear at the 45-degree angle, and it did. So I'm going to continue down and check the patient's skin. Again, the skin temperature is warm and equal bilaterally. The color is symmetrical. I'm going to check for her brachial artery pulse. 2+ bilaterally, moving down to the radial pulses bilaterally. Again, 2+. I'm going to check her fingers. There's no clubbing noted. There's no lesions. Her skin appears to be intact. Capillary refill is prompt. It's less than 3 seconds. Moving down to her legs, noting any pitting edema or skin color changes. There's no pitting edema. Checking for her popliteal pulse. It's faint, it's a 1+, posterior tibialis. Again, faint, 1+ bilaterally, and then dorsalis pedis. 2+ bilaterally. And then I'm going to take the patient's socks off. Cute toenail color.
Thank you.
And then I'm going to check for any capillary refill in the toes. Less than 3 seconds. Bilaterally. And then I'm going to assist you to stand up, and I'm just going to have you walk a couple feet for me. And before I do that, I'm going to check your grip strength. So squeeze my fingers. Grip strength is equal bilaterally. Go ahead and stand up. The get up and go. Her gait is steady. There's no signs of wobbling. And then just go ahead and close your eyes for 20 seconds, and I'm going to note any swaying. 20 seconds has gone by. She appears to not be swaying. So I'm going to have you sit one more time, and I'm going to check your Babinski reflex. So Babinski is negative.